The nausea and vomiting for her was so terrible, she wouldn't consider continuing on.
Sure.
And that was despite 4-drug prophylaxis. So that preemptive prophylaxis is really important. Fortunately, most patients fall in the middle of those two. Those are two very extreme examples, but that building in that prophylactic regimen is so critical.
We've learned that over time with anthracyclines.
Right.
So perhaps in this neoadjuvant setting, we're going to need to think about that similarly, even with T-DXd.
Absolutely. And this is a treatment naive group, right? Yeah. So they haven't had exposure to any of the side effects of any of our therapies to date. And so
they don't know how to use any of the drugs yet, even the supportive drugs.
Correct. Yeah. And so education is really important.
So coming back to the PCR, is that a meaningful enough endpoint to change care? Of course, the event-free survival is not, mature enough to know what strategies the best.
I think the FDA would say no. So I think it is, and we've seen this in the triple negative setting with immune therapy, that the health authorities want to see the translation of PCR benefits into event-free survival benefits. And they've shown through their own cortisol meta-analysis and other similar studies with thousands and thousands of patients that PCR is very highly correlated with event-free survival.